And we'll demonstrate as good as we can here on video. My goal is not just to actively roll this part of the muscle. I want to shift it a little bit. Hey guys, Coach Kyle here. Today we're going to talk some soft tissue mobilization for managing knee pain, particularly talking anterior knee pain, more looking at quadricep tendon and or patellar tendon. So when we talk knee pain, a lot of times it can be like elbow pain. A lot of lifters, a lot of strength athletes come to us with elbow pain and knee pain. Well, that can be really broad. We might need to address IT band, adductors, hamstring attachment, calf attachment. We're not going to go there today because that'd be too much. One of the things we see a lot is just overactive quads. Big squatters, strong athletes, we're usually pretty quad dominant, have good development of those quads. It also pulls us into an anterior tilt, which we'll talk about briefly. So we have all this pulling onto the top of the kneecap, and the kneecap attachment through here. A lot of times that just makes some tight, not correct tracking as well through the kneecap. So when we first get into a squat, especially if it's been a big squat day a couple days before, things are just tight. There's a lot of anterior knee pain. That's what we're going to try to help you address today. So moving on to the floor, the first thing we're going to show is just some static pressure here. So of course I've got the big Geisha on, weighs about 135 pounds. I would let this sit for up to 5 minutes. 3 to 5 minutes the day after legs is my favorite. You could do this as well right after a squat session, but personally I find my quads tighten up a little bit more the day after. So if I was going to bench, this would be probably part of my movement prep before I moved on to the bench press. Just helping that quad recovery. You can get some active rolling in here too after I let that set there. And just to clarify, I'm looking at right above the kneecap. So I'm not onto the kneecap, but I'm definitely not inches above it. If you need, you can always place a finger there so you don't feel like you're running on top of your bone. And that's with the big unit. You might want to warm up with something smaller. Pain pill is a great example of that. I can always add some down pressure here. So we've had some static work. Now we're going to get into some active rolling. The outside of the quad, vastus lateralis, not so much the IT band, but the actual side of the leg here. And we'll demonstrate as good as we can here on video. My goal is not just to actively roll this part of the muscle. I want to shift it a little bit. And you'll see how that shoved the muscle up on top of my leg. You can see I have my toes pulled up and how that actually activates the quad as well. There's some internal rotation here, allowing me to pull that muscle over a little bit. I'm just going to actively roll. Then I'm going to shift to the inside of the leg, getting vastus medialis. Same thing, toe pulled up, some external rotation here. Get some roll through that muscle. Not directly down on top of it, but shoving it up and over. For most athletes, unless you're really sore after leg day, are probably going to find an imbalance. I'm usually tight on the outside, tight and sore, compared to the inside. We don't have to get super scientific with it. That's just telling us we're going to spend a little bit more of our time. The other cool thing we can show here with the knurling of this is you can see how I'm actually, once my quad is engaged, I'm actually pulling up on the tissue. That can help lengthen, as you can imagine, through all of this tight tendon tissue here. A couple days a week will help work magic. Lastly, we'll move on to some flossing methods. Myself some room here, we're going to demonstrate some squats. Sometimes we prefer the wider floss just because it wraps a little bit more of the leg, but we'll demonstrate with the more common narrow band here. I'm going to the same spot that I first started at, right above the kneecap. It's going to be some athlete's individual preference on how tight to make this. I was a geared squatter for years in knee wraps, so I don't mind extra tight tension here. Really comfort level. It's something you can work into, just like the differences of weight here with the different items. Normally I would wrap both legs at the same time to free them both up. And then I would either start my movement prep with some body squats, kettlebell goblet squat, maybe moving into the bar actually while loaded, unracking, getting a good brace, my good setup work, making sure my feet are rooted so my knee's doing a good job to begin with, and going through the motions. The reason I bring this up is because a lot of people will actually floss or foam roll for quite an extended amount of time before they even warm up. If you guys are doing quad extensions, belt squats, leg press on top of any other squats, you're already going through the range of motion. Even after squats, if this gets tight, wrap it up like we just demonstrated and do some eccentric quad extensions, some regular quad extensions. We don't have to get super scientific with it. We need you to roll the muscle, we need you to release some tendon tissue, and we need you to be actively moving that underneath the floss. A couple minutes, 3 times a week, you'll definitely notice a difference in how well the joint moves and how tight that musculature is. So to recap, we're talking simple, soft tissue mobilization for managing knee pain. But again, we could spend hours talking knee pain. The most common we see here is tight quads pulling on the kneecap, causing anterior knee pain. That also pulls us into an anterior pelvic tilt, messing with our bracing and our quality of our squat mechanics. If we can release this, our knees feel better, we're more confident getting under bigger load, and we can do a better job stacking that pelvis underneath our rib cage to line up for a big squat.